Behaviour modification theory. Remembering the main points that we already looked at, where behaviour modification theory uses positive reinforcement or reward for a desired behaviour and negative reinforcement or punishment for an undesired behaviour.
The main health promotion intervention is changing one's lifestyle. Change of lifestyle is a behavior transformation that requires a collection of commitment. The various aspects of an individual lifestyle that can be changed of improved health include nutrition habits. The food individuals eat have a direct impact on the health of their bodies. Instead of eating to get full, individuals should concentrate on increasing their energy level, benefiting their digestive health and improving their general health. Individuals should also hydrate their bodies by drinking at least 3 liters of water daily to ensure good health. Engaging in physical activity habits, one in maintaining a healthy weight and body mass. This minimizes the threat of weight-linked medical illnesses. Exercise can also assist in maintaining the health of muscles, joint, and weight as one age. Effective management of stress can also assist people in returning their proper physical and mental health. Good sleeping habits of 7 to 9 hours per night can also be active in ensuring good health. The use of daily supplements such as nutrients and vitamins also helps in managing a healthier lifestyle. Other intervention: improving living standard, improving general public health, increasing access to healthcare center, understanding socio-cultural practice. By reducing unemployment can be of great help to the unemployed people because they can get income to cater of their health needs. Also, improving the general public health by dealing with disease such as obesity can be of help as well. Insurance cover should be made affordable and accessible to everyone in the country, irrespective of the class, as well as transport system of hospital or to hospital. On socio-cultural practice, a guide should be developed to assist health professionals in understanding the culture, performance, and futures worldwide.
Hi, my name is Abby, and I'm talking about behaviour modification theory and the settings where it is most likely to be used or recognised. And following this, I will discuss some criticisms of the theory and the use of this theory when targeting childhood obesity. Behaviour modification theory can be used to explain the majority of health intervention programs, as most programs seek to either increase or introduce certain positive behaviours, for example, adequate exercise, healthy diet, and compliance with prescription medications, and decrease or eliminate certain negative behaviours, for example, sedentary lifestyle, high-fat diet, and smoking. However, a criticism of this theory is that it does not fully explore, explain, or address the motivation behind the behaviour. In addition to this, there is such an enormously broad perception and interpretation of rewards and consequences, leading to the lack of consistency when using this theory. There is also the criticism that this theory requires far too much facilitator involvement due to the enforcement of punishments and consequences, and is therefore less versatile and practical. Despite these criticisms, there are aspects of this theory that are very useful in terms of encouraging certain behaviours and limiting or ceasing certain behaviours. In view of this, it is most commonly seen now in conjunction with other theories. An example of this is a study in China combining the social cognitive theory with elements of the behaviour modification theory to address childhood obesity in children aged 7 to 12 years. The researchers sought to improve physical activity by increments each week, as well as gradually decreasing the number of times they ate unhealthy foods per week. Children were provided with a small financial reward at a certain point in the study if they had reached the activity targets set for them. In line with using monetary incentives to reinforce positive behaviour, the Active Kids program provides $100 to parents who enrol their children in structured sporting programs lasting longer than 8 weeks. By applying the social cognitive theory to this scenario, it is anticipated that it would develop into a routine for these children through the repetition of this physical activity over 8 weeks.
According to the Australian Institute of Health and Welfare, in 2017-2018, almost 1/4 of children aged 5 to 17 years were overweight or obese. Being overweight or obese as a child has serious implications for long-term health outcomes, as it is a major risk factor for cardiovascular disease, type 2 diabetes, high blood pressure, sleep apnea, psychological issues, and some musculoskeletal conditions and cancers. To combat childhood obesity, the New South Wales government has started an initiative to promote exercise. Weekend sport has both a financial and time burden for parents. By the government providing parents with financial benefits for enrolling their children in exercise events, it is removing the undesirable stimulus of debt. Within behavioural modification, this is referred to as a negative reinforcement, where the government is taking away an unwanted outcome. The $100 may be seen as a bonus by the parents. It is a reward for supporting their children to make healthy behavioural choices. This positive reinforcement, the money, will support positive health change, as parents will be more likely to re-enroll their children in sporting activities in the future. By giving money, something that the individual values and desires, the government is establishing a positive association with participation in sport. By withholding the funding if the child does not participate in sport, the government is providing a negative punishment towards their undesirable choice.